My husband and I really love to travel quite a bit now, especially since I'm not working full time. I'll gather groups of people and we will travel overseas. We're in Spain and Portugal, and we're up and down on the buses. And by the middle or the end, it was almost impossible to be going up and down. Some of the people I work with had said, you could try the gel and you can try the steroids, which I did, hoping that would help them. And they didn't. I was planning another trip and I thought, okay, I have really got to be able to walk if we're going overseas again. I did think, of possibility of going somewhere, and I thought, I wouldn't have wanted that drive back up after the surgery. That's kind of crazy. So I learned about Dr. Bolin through a couple of friends of mine. Dr. Bolin had been recommended to them if they ever needed to get any surgery, and made an appointment with him, and he confirmed they were pretty much bone on bone, and did I want to go ahead and start this process? And I said, yeah, I suppose we should. There was always the option of having both knees done at once, which Dr. Bolin really did not recommend, and I was fine with that. I really was kind of open to whatever he thought we should do. Prior to surgery, there is a joint class that you go to. Like I said, mine happened so quick. I had like 2 weeks or something to get ready and get everything done. And so we did a one-on-one class, actually. So that helped. In the binder that you're given for the joint class, they show you the actual exercises. And a lot of them are the same that you're doing when you get to physical therapy. So they're helping you as much as they can to get you prepared. So I went in that morning, and they all prepped, and I think we were thinking like 2 hours or so. I really wasn't sure. Woke up in recovery, and I think the surgery was 40 minutes or so. It was incredible. My husband said they were done in no time. And then they get you up walking. And then when we did the second one, that one was a little bit harder because there was a nerve in my hip that kind of got involved. So that took a little bit longer, but the leg was stronger because I was able to work it out. When I was doing physical therapy on the first one, I would go ahead and do the second one also. It's going to be a little painful to begin with. And once you get past those first 2 weeks, it starts getting better. And my thing is just do it. The pain will be different. It won't be the knees anymore. It'll be because you've got to work the muscles around the knees now. You get pain medication when you leave. And I took it for a couple of times, not a lot. Did about 8 weeks of physical therapy for each one. So I guess I was in there about 16 weeks. Physical therapy is just a starting point. You really have to exercise these legs every day. Everybody at Shannon was really helpful with everything, from the surgery to the physical therapy.